health sector is one sector where the role of awareness cannot be ignored, and the role of right awareness, right information, right education cannot be ignored at all. It's an integral part of the overall healthcare. It is not only health awareness, it is the healthcare of the society, it is healthcare of the people at large. So, and here the role of media and the health media, this cannot be taken separately, because what they write and what the people read about healthcare through in the country, it is all through the media. So before the advent of Google, it was only the print media, the TV media, from where people used to get all information about healthcare. Now, of course, there's Google and a lot of other portals and a lot of other social media from where you get the information. Digital media is getting very prominent. So going forward, we have included the bloggers and the digital media also to be a part of this ongoing process of healthcare writers, editors and bloggers, capacity building, education, training, what we have been doing for the last 12 years. I remember in 2005 when health writing was still at its very nascent stage, and we gathered together in Goa. There were about 25-30 prominent health writers. One of them was Mr. Shankar. He was the editor of New Indian Express from Bangalore. We had people like Ms. Kalpana Jain, Dr. Sumit Ghoshal, who is amongst us today, and a lot of other senior people, Mr. Vivek Shukla from Dainik Jagran, a lot of vernacular media people also came forward. And there we took a call that we should form a group wherein we should stand for a very specialized ongoing program towards empowering these health writers. Because what was happening in the country at that time, I remember in 2005 and then onwards for another 5 years, 7 years, 8 years, that health writing was not taken seriously. There was no dedicated health beats for the journalists who were covering crime, who were covering entertainment, films, politics. They were suddenly asked to go and cover the press conferences of doctors, press conferences of health ministers, which was going over the roof because they didn't have any background, any understanding of healthcare. So that the copy which was coming in the media was not the copy which should be written for healthcare journalism. So people were thinking that the healthcare journalism standard in India is very, very low, and there was a lot of miscommunication happening, because a wrong story can do much more damage to what a right story can create awareness in the society. So to prevent that, this whole program of HEAL, what Mr. Shankar told in his inaugural welcome speech, that this whole program of HEAL, that is called Health Essayist and Authors Group, and this whole active group of health writers and editors was created. We are fortunate to have more than 200 members till date. More than 200 members, is growing, and now we are getting more regular. But to tell you, in last 12 years, we have done not 50, we have done more than 100 workshops, which are dedicated workshops for training of health writers. So these sort of programs were, if you have only seen in the medical fraternity or the medical industry, where there is a continuing medical education program for doctors. So there are pharma companies, there are hospitals, everybody in the healthcare industry invests on them, on the doctors. But nobody was ready to take this program of education, capacity building, training for the writers, which I think is more important than training and upgrading the knowledge of doctors. What is more important is training and upgrading the knowledge of health writers, because of the simple fact, a doctor in his lifespan can see maximum 4,000, 5,000, 10,000 patients whom he directly communicates to. A health writer in his lifespan, even if he writes 100 stories in a year or 2 years, has the capability to reach to few lakhs and 1 crore of people at one time. So that is the importance of training and education of health writers, and with this objective we started this health writers program. And we have taken, this is the 5th national convention, so we have already done 4 national conventions. We have the privilege of having almost all the central health ministers attending and honoring these conventions, starting from Dr. Ambumani Ramdas to Dr. Harshvardhan to Mr. Ghulam Nabi Azad. And so all the health ministers have been a part of it. And we have the privilege of having states now coming forward. The Goa health minister was the chief guest for our last program. The Telangana, the newest state, the youngest state, health minister is among us as a chief guest of this program. And we see continued support from various states and the government and the public bodies to come forward and take this this whole initiative to make it more successful, to support these initiatives. So as just touch on few points. So we have done, we have taken a lot of unique initiatives of bringing in paradigm shift in the behavior change, in the thinking change toward healthcare issues. Few of the issues we have touched on are like, for example, the guidelines which were created for school canteens, that junk food should not be allowed in school canteens, was our initiatives. Then there was a hot discussion in the last panel on labeling guidelines. So I remember it's about 10 years back when this initiative was first taken up on the platform of HEAL, that labeling on all the products should be made mandatory, and these should be the various parameters of labeling on the products. Then we have dealt so deeply on a lot of nutrition issues, because nutrition, the non-communicable diseases, the metabolic diseases, these are the things which haunt our society, the healthcare of the society in a big way. Now you are seeing the Millennium Development Goals moving from the communicable diseases towards non-communicable diseases. So there again the role of awareness is most important. So we have taken issues on trans fats, on other obesity, the kids obesity, a lot of things, studies, surveys, reports we have released on this platform in the past, addressed by the topmost experts of the country who have come from all over on this platform. So we have also a module of creating experiential programs. So I remember we created a program for health writers, because health writers generally, what has been always haunting me, that they are only exposed to the press conferences and press releases, and like all other journalists, that it's a one-way communication, that there's a press conference by a doctor, there's a press conference by a minister, there's a press conference by a hospital, or there's press conference by a spokesperson from a pharma company or from a corporate, and that's a one-way communication where they come and tell that what they feel is right. It's not been in the form of a workshop and engagement, what we do on our platform, and that makes us different. So we have taken health writers to the cath labs where they have experienced how an angiography procedure is done, how an angioplasty procedure is done, what are various things in heart care and the treatment modules in heart care. And we have done workshop on various diseases and treatment modules for patients. And so one of the very common subject, and which we are taking in this program, in this convention also, tomorrow you will see that we are doing a very thorough workshop on interpreting studies, mostly the international studies. Unfortunately for us in India, most of the research and studies, 95% of them are still done on the foreign soil. It is done by the universities across the world, mostly from US, from Europe, and mostly the developed countries, universities who do the research, and there is a lot of information coming through international wires which are picked up by the Indian media, and what we have seen quite often, that the interpretation of those studies has gone wrong at many times. As Mr. Shankar was just mentioning in his welcome speech about at one day in the morning you read that coffee is good for your health, second day you read that coffee can be dangerous for your heart. So these are such misinterpretations and cross-interpretations and confusions which have been created by this. So we are doing a special session tomorrow on interpreting international studies, and in this endeavor only, we have created this whole pledge program for the first time, wherein we want to reduce the factor of what you see, the fake news issue coming up, particularly on the social media and digital media, where we want to reduce the factor of fake news or not the right kind of news and videos on healthcare being floated. So the pledge is about mentioning the source, mentioning the references, because in a medical journal or a peer-reviewed journal you have heard of in the medical fraternity, this is always mandatory to mention the reference and the sources of the facts and figures or the claims which are being published. The FSSAI, Advertising Standard Council of India, they are also moving towards making these mandatory for the labeling or for the advertisement, that you have to mention source or references to the claims. So why not the health writers? When there are stories being published and you are referring to a quote, to a claim or to a data or to a statistics or to certain facts, why can't the health writers make it mandatory, or it should be made mandatory, that the source and the references are mentioned there, so that the stories and the videos which come out are more authentic. So this is one big thing which we are doing to go on a continuous basis. through this fifth Health Writers Convention, we are going into some very unique initiatives and very continuous, regular initiatives, because we have been doing on and off so many things. Many things have worked, many things have not worked. But what is definitely going to work is the continuity of this whole process, which definitely is going to create a big impact over a period of time. And so, one of the initiative is, as I told you, about the sources, references, which will create a lot of noise. The petitions going to Facebook, Google, and Twitter and everywhere, that they should also come up with any video you share on Facebook, unless until it is referenced, unless it is the source is mentioned, the video the Facebook should not upload. Particularly for the health stories. It can be for any other drama or any other entertainment sort of news, but it cannot be for healthcare stories. So that is one thing. Then we are tomorrow launching a fellowship program for health writers. We'll give the details definitely tomorrow, but we have associated with bodies like Indian Institute of Mass Communication, the New Jersey School of Journalism and World School of Journalism. These are bodies we have collaborated to do a continual process of educating and working with the health writers to give them fellowship, scholarships, and motivate the authentic and the genuine and the credible health writing for a lot of the guys who are so serious and they want to know more, they want to write more, particularly in the vernacular media, people sitting in maybe a Hyderabad Telugu papers or Maharashtra Marathi papers or Tamil papers. They are the people who are deprived of lot of access to the information or the sources or to the international experts, and so there we are going to work with them to get them that sort of exposure, the international exposure, the national exposure, and it will become a continued program. In our experiential program module, tomorrow we have organized a special trip for all the health writers to the one of the largest medical devices company of the world, Medtronic, who have opened their gates to show their R&D center, innovation and R&D center in Kachibowli, wherein we are taking all the health writers to see how the innovation R&D in medical devices is happening all over the world and learn from that experience one-to-one. So that is one of the key initiatives which will keep continuing. So with all these words, thank you so much.